I'm Kristen. I'll be your nurse practitioner today. Can you please state your name and the date?
Catherine Nax, October 5th.
Okay, and how have you been feeling lately?
Good.
Any problems?
Nope.
Good. Patient is awake, alert, oriented, ×3, mood and effect is appropriate to situation. Now I'm going to have you look at these 4 objects and remember them. I'll ask you about them later. Now can you repeat these numbers after me? 10, 8, 6, 4, 2.
10, 8, 6, 4, 2.
Immediate memory intact. Now can you please state your mother's maiden name?
Brewer.
Remote memory intact. Now can you tell me what the phrase calling the kettle black means?
Being a hypocrite.
Okay, and if you found a letter with a stamp on it, what would you do?
Mail it.
Okay, abstract reasoning and judgment within normal limits. Now, if I had 3 apples and I gave you 2, how many would I have left?
1.
Patient able to perform simple calculation. Now I'm just going to look at your head here. And just go ahead and look straight ahead. Okay, face is symmetrical and smooth, no acne. Patient has 2 small dimples, scars above eyebrows from a previous halo injury. And patient's face is pink. Now I'm going to just feel your scalp. Tell me if it's tender anywhere.
Nope.
Okay. Scalp is freely movable, no indentations or swelling. Hair is blonde, dry, and thick. Now I'm going to just feel your sinus areas. Tell me if you have any tenderness.
Nope.
Okay. Sinus area non-tender, and no swelling. Now I'm going to feel your neck. Tell me if you feel any tenderness here.
Mm-mm.
Lymph nodes unpalpable, no swelling. Now I'm going to just feel your trachea here. Can you swallow for me? Good. Trachea not swollen. Trachea moves up and down when swallowing, no swallowing difficulty. Now I'm going to feel your thyroid. Okay. Thyroid palpable. Borders are smooth and regular. Now I'm going to check your 5th cranial nerve, your trigeminal nerve. I'm going to have you close your eyes. First I'm going to check your jaw movement. Just open your mouth, close it. Jaw is strong and no crepitus felt. Now I'm going to have you close your eyes and tell me when I am touching you.
No. No. No.
Okay? Now with your eyes still closed, tell me if you feel a sharp or dull sensation.
Dull. Sure. Dull. Dull.
Okay? Trigeminal nerve intact. Now I'm going to check your 11th cranial nerve, which is your spinal accessory nerve. I'm going to have you turn your head against my hand. Good? And on this side? Good? And shrug your shoulders? Good. Spinal accessory nerve intact. Now I'm going to just listen to your temple here. No bruit auscultated. Temporal bruit. No carotid bruit auscultated. Now can you repeat those 4 objects I asked you to remember?
House, tree, dog, and nurse.
Good. Now I'm going to check your 3rd, 4th, and 5th cranial nerve. 4th, 5th, and 6th cranial nerve. It will be your ocular motor, your trochlear, and abducens. Okay? I'm just going to look at your eyes here. Okay. Pupils are about 3 centimeters and reactive. Now follow this pin line. Good. Cranial nerve 3, 4, and 5, 6 intact. Now I'm going to just look at your lips here for symmetry. Lips are pink and moist and symmetrical. no cracking or dryness. Now I'm going to have you open your mouth and just look inside your membranes here. Okay, mucous membranes are pink and smooth and symmetrical. Can you smile for me? Can you puff out your cheeks? Can you raise your eyebrows? Can you squint your eyes? Good. Seventh cranial nerve intact, which is your facial muscle or facial nerve. Now I'm going to just kind of smell your breath. I want you to say, the dog ran after the cat.
The dog ran after the cat.
Voice is audible and clear. No halitosis or bad breath. Now I'm going to check the back of your throat, your tonsils, with this. Okay, tonsils visible at a 1+. Can you say ah? Uvula rises. You can stop. Uvula rises with palate. Palate is smooth and symmetrical and pink. Mucous membranes were smooth and moist. Now I am going to check your 12th cranial nerve, which is your hypoglossal nerve. I'm going to have you stick out your tongue. Now can you touch your chin? No, with your tongue. No, touch your nose with your tongue. And now side to side. Great. Hypoglossal nerve intact. Now I'm going to check your glossopharyngeal nerve, which is your 9th cranial nerve. I'm going to have you open your mouth, check your gag reflex. Okay. Gag reflex intact. Now I'm going to have you tell me if what you're tasting is sweet or sour. Okay. I'm just going to place this on your tongue.
Sweet.
Okay.
Sour.
Okay. I'll go ahead and give you a little drink to wash that down. Now I'm just going to check your eyes. I'm going to have you look straight ahead. Iris is blue in center of eye. Borders are round and symmetrical. Sclera is white with no redness or swelling. Conjunctiva is pink. No discharge noted. Lids cover top of iris. No ptosis, intropin, or ectropin noted. Now I'm going to feel your lacrimal ducts. Tell me if you have any tenderness.
No.
Lacrimal ducts, no swelling and no tenderness. Now I'm going to have you just close your eyes. I'm just going to look at your eyelashes here. Eyelashes present on both lids, evenly dispersed. Lids are pink with some eyeshadow, no swelling or redness noted. Okay, now I'm going to just look into your eye here. Okay, be a bright light. Red reflex noted. I'm going to have another bright light. I'm going to just check your lens right now. Okay. Lens clear. Now I'm going to have you hold this, cover one eye, and tell me the smallest line you can read.
428,739.
Okay. Optic nerve intact. That was your 2nd cranial nerve. Now I'm going to have you hold this over one eye, and I'm going to move my fingers, okay, in several different positions, and you tell me when you can see my fingers moving.
Now.
Okay?
Now.
Good.
Now. Now.
Okay. Peripheral vision intact. Now I'm going to just fill your nose here. Nose is smooth and straight, no crepitus or deformities noted. Now I'm going to have you blow out and in. Good. nares are oval and patent. Now I'm gonna look into, or I'm gonna check your first cranial nerve, which is your sense of smell, the olfactory nerve. With one nose closed, with one nostril closed, tell me what you smell.
Cinnamon.
Okay. Now with the other nostril.
Vinegar.
Okay. Cranial nerve 1 intact. Now I'm going to look into your nose. And just check your septum here. Okay. Septum is midline and straight, no deviation or redness or swelling. Mucous membranes pink. I'm gonna fill your ears now. You have any tenderness?
Nope.
Okay. Ears are symmetrical, midline in face, top of ears, raised middle of eyes. I'm gonna look inside your ears. Ear canal is clear. Tympanic membrane is a pearly gray color and bony landmarks noted. Now I'm going to have you kind of turn your back towards me. I'm going to check your 8th cranial nerve, which is your acoustic nerve. I'm going to whisper something and you tell me what I say.
3TN.
Good. Now you can turn around. I'm going to place this in the middle of your head. You tell me if you can hear it better in one ear or the other, or equally in both ears.
And both.
Okay. Now I'm going to place this on the back of your ear, on your mastoid bone. Tell me when you can no longer hear it. I'm going to move it in front of your ear and tell me when you can no longer hear that sound, okay?
Now. Now.
Okay. Bone conduction, or air conduction, heard twice as long as bone conduction. That was the Whisper, Rhine, and Weber testing. Acoustic nerve intact. Now I'm going to have you stand up. I'm going to have you bend your head forward. I'm just checking for your cervical spine here. Can you turn it side to side now? Now touch your ear to your chin, or ear to your shoulder, sorry. Okay, now the other side. Okay, cervical spine straight and midline, no curvature. Now go ahead and bend and touch your knee, or touch your toes. Okay. Thoracic and lumbar spine, straight, midline, and no curvature. Can you move side to side? Bend. Any pain?
No.
Okay. You can go ahead and have a seat. I'm going to just feel your skin here. Okay. Skin is warm and pink. You can look at your nails. Nails are smooth, regular, no clubbing noted. Nails are strong, and capillary refill is less than 3 seconds. Okay, you want to go ahead and lay down. I'm going to just take a look at your abdomen here. I'm going to lift up your shirt just a little. Okay. Abdomen is flat, minimal striae noted from childbirth. No hernia present. I'm going to listen to some bowel sounds now. vowel sounds heard in all 4 quadrants. You're going to listen for some aortic and renal bruits. No bruit auscultated. No renal bruit noted. Now I'm going to feel for your kidneys. Okay. Kidneys unpalpable. Now I'm just going to, you can relax your back. I'm going to just feel your stomach. Tell me if any part is tender.
No.
Okay. I'm going to press a little deeper now. Spleen and liver. Spleen unpalpable on deep palpation. I'm going to press pretty deep here. Liver palpable along sternal border. Borders are smooth and regular. Okay. Now I'm just going to kind of tap my finger and listen. Timpani heard over splenic area. Now I'm going to palpate for your liver, or percuss for your liver. Okay. I'm going to just make a little mark here. Okay. Now I'm going to just measure. Liver span is 6 centimeters. Now I'm just going to feel some pulses here. Go ahead and lift your shirt down for a minute. Okay. This is your brachial pulse, and that was your radial that I just felt. I'm going to pull up your pant legs here and feel underneath your knee. Okay. These are your popliteal. Posterior tibial are inside your legs. And then your dorsalis pedal. All pulses palpable at a 2+. I'm going to just check your pulse right here. Pulse is about 74 beats per minute and regular. I'm going to lift your shirt up again. I'm going to look for your aorta, aortic pulse. No pulse palpable or visual. Palpable aortic pulse. I'm going to feel your chest. No lifts or heaves noted. I'm going to check for jugular vein distension. No jugular vein distension noted. Now I'm going to listen in 5 different areas, starting with the mitral area first, which is the 5th intercostal space. Now the 4th intercostal space, which is the tricuspid area. And the 3rd intercostal space is the pulmonic area. 2nd intercostal space on the left border is the pulmonic area as well. And then 2nd intercostal space on the left, on the right, is the aorta. Okay, I'm going to have you sit up now. I'm going to listen in those same areas with you sitting forward and leaning forward a little bit. Okay, S1 is heard loudest at the fifth intercostal space, which is the apex, and S2 is heard best at the second intercostal space on the left border, which is the pulmonic area. Now I'm just gonna look at your respirations, okay? And inspect your chest. Chest is flat, breathing is symmetrical, and expansion is equal. Exertion is effortless. I'm just gonna kind of feel your back here. Respiratory rate is about 14 a minute. I'm gonna have you kind of turn around. I'm gonna feel your back. Can you repeat 99 for me?
99.
Minimal firmitus noted. No masses felt on back. I'm gonna listen to your back real quick, just for your breath sounds. Breath sounds clear in all areas. Now I'm going to check for diaphragmatic excursion. I'm going to need my pen here. Let's tape measure. I'm just going to listen for area dullness. I'm going to have you take a deep breath in and hold it. You can go ahead and breathe for a minute. Now I'm going to want you to take a deep breath in, exhale, and hold it. Okay. Ready? Okay, you can go ahead and breathe now. I'm just going to measure this area here. Diaphragmatic excursion is 4 centimeters. Can have you lay back now. I'm going to just measure your transverse ratio here. Do it in inches. Okay, that's about 11 and a half width and about 5 and a half depth. Transverse ratio is 2 to 1. Now I'm going to feel your sternal angle here, kind of measure. And go ahead and lift your shirt up. Okay. Sternal angle is about 45 degrees. I'm going to have you sit up again. I'm going to have you turn around a little bit. I'm going to kind of hit my hand and check for some tenderness in your kidneys. Tell me if you have any tenderness.
No. No.
Okay.
No.
No CVA tenderness. Okay. Now I'm going to have you stand up. I'm going to move all this. Go ahead and just stand right there. Turn around and face me.
Okay.
Just keep your arms straight out. Okay. Extremities even. Musculoskeletal system intact, within normal limits. No deformities noted. Now I want you to go ahead and just move your wrist, all of your joints. Okay. And now move your elbows. Great. And now your ankles. Okay. Good. Range of motion performed in all areas. No. Did you have any tenderness?
No.
Okay, no tenderness noted. I'm going to have you sit back down now. I'm just gonna feel your knee here. Okay, just relax it. Now lift it up. Okay. Now, no crepitus heard or felt. I'm gonna kind of flex your knee up. I'm gonna do a Homan sign and a clonus. You tell me if you have any tenderness in your calf.
No.
Okay. No clonus or Homan sign. Okay. Now I'm going to check your lower and upper body strength. I'm going to have you push out your legs against, okay, now push them in, good. Now turn your arms, pull up, good, and now push down, good. Muscle strength symmetrical and strong. Now we're going to check your walking and your neurostatus, and that's the last thing we have. I'm going to have you stand up. I'm going to have you walk a few steps that way and then turn around and walk back. Okay. Now I want you to walk with one foot in front of the other on this straight line. Good. Now back. Okay. Gait is smooth. No swaying. Noted. Now I want you to go ahead and you can stand against the bed. I want you to stand on one foot for me. Okay? Negative Romberg test, no swaying noted. And I checked your spine already. Everything was in good alignment with your spine, so now we can have you sit down. I'm going to have you, with your right heel, drag your heel up your left shin to your knee. Good. Movement is smooth and symmetrical. No difficulty performed. Now I am going to check, if I can find my pen, here we go, what we call the Babinski sign. It's going to be a little uncomfortable. Okay. Well, a little ticklish. Positive Babinski sign, toes fan. Now, with your eyes closed, tell me if your toe is pointing up or down.
Up.
Okay. And with your eyes still closed, tell me if your finger is pointing up or down.
Up.
Okay. Patient has correct sense of position. I'm going to just set this down. Now I'm going to have you touch each finger to your thumb, like this. Great. Okay, can you do it faster? Good. Okay, now I'm going to have you touch your nose with your finger and then touch my finger, and then back to your nose. Okay, movements are smooth and symmetrical. No difficulty with movement. Now I'm going to have you, with your eyes closed, I'm going to draw a letter or a number in the palm of your hand. This is checking gravesthesia. You tell me what I'm drawing in your hand.
8.
Okay, and with your eyes still closed, I'm going to place an object in your hand, and you tell me what object this is. This is testing stereognosis.
The key.
Good. Okay. Now I'm going to have you close your eyes again. You tell me whenever you feel, I'm going to pull your pant legs up first. Tell me when I'm touching you, okay?
No. 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 No.
Good. Now tell me if you feel, with your eyes closed still, a sharp or dull sensation.
Dull. Sharp. Dull. Sharp.
Good. Patient correctly identifies sharp and dull sensation. Last thing we have to do is to check your reflexes. I'm going to check your tricep reflex first. Okay, tricep reflex is about a 2+. Now your brachial. Okay, bicep reflex is about a 2+ as well. Now your brachioradialis. Okay, brachioradialis is about a 2+. Now your patellar. Okay, patellar is about a 2+. And now your Achilles. Okay, Achilles is about a 2+ as well. This concludes our assessment. Do you have any questions for me?
No.
Okay, thank you very much.